you so much for having me today. It's a real pleasure to be talking to you all about a passion of mine, an area that I do a lot of clinical work and research in. And the title of my talk is going to be Hepatitis, Fatty Liver, and Cirrhosis, Common but Often Silent. So as an outline, I'll provide a overview of what the liver does, go over some common liver diseases, talk about cirrhosis and its complications, and then review some common myths. And I'm welcome to take or happy to take any questions at the end. So as an introduction first to myself, as you mentioned, my name's Andrew Moon. I'm a transplant hepatologist. So I take care of patients with the liver disease. And while transplants in my name, they don't necessarily have to be pre or post transplant. But I do take care of patients from the medical side, both pre and post transplant. My specific area of interest is in liver cancer. And so I'm a member of the multidisciplinary liver cancer clinic at UNC. I'm a clinical researcher. I spend most of my time doing research on risk factors for liver disease and liver cancer, as well as some other aspects of hepatocellular carcinoma, which is the most common liver cancer we come across. I'm a dad and a husband, and I'm a sports enthusiast, and this involves many driveway sports with my daughters, which is always fun. So, with that, let me get into the topic. So, I'll first talk about what the liver does. And I'm biased, but I think the liver is immensely important. It definitely in the top three most important organs. It's one of the largest organs in the body. And one of the things I always mention to patients to kind of reinforce how important it is that we've been able to come up with artificial hearts and artificial kidneys, dialysis, artificial lungs, but have never really been able to develop a successful artificial liver. And part of the reason why is because of how complex it is. The liver does so many things. It essentially acts as the factory of the body. So if you eat foods or uh, anything else that you ingest, the stomach and intestines digest it, they break it down into raw materials, and then those raw materials are brought to the liver. And the liver kind of works to use these raw materials to break them down, to purify them, to make useful products, and to get rid of harmful things with filtration. So, some of the specific things it does is it makes proteins that help feed your muscles and help with blood clotting. It detoxifies the blood, so getting rid of harmful things in the body, including things like alcohol. It produces bile that helps digest foods and particularly fats. And then it gathers and stores substances for the body to use later, things like vitamins and sugars and other products that your body can use. So, with that background on what the liver does, let me get into some of the common liver diseases. So, MASLD, which is a relatively new term for this, is what we used to kind of call more generally fatty liver. So MASLD stands for metabolic dysfunction associated steatotic liver disease. So it used to be called non-alcoholic fatty liver disease or fatty liver. There's a couple reasons why we switched the name up. One is that it was kind of silly to define it by what it wasn't, saying it's non-alcoholic. And so the kind of community, hepatology community, decided we should define it based on what its risk factors are, which is metabolic risk factors. And I'll circle back to that. Um, the term fatty was taken out of NAFLD and changed to steatotic because fatty can be a stigmatizing term, and folks can, we associate with fat with, lifestyle choices. In reality, fatty liver or MASLD is not just the result of lifestyle choices. They undoubtedly play a role, but there are a lot of other factors including genetic risk factors that cause this disease. Now, it is more common in folks with diabetes and obesity and high blood pressure and high cholesterol. And as I had mentioned, a defining feature of it is that patients with MASLD drink little to no alcohol. Now, it's incredibly common. So, up to 100 million Americans have MASLD, about 30% of all people in the US. So, I always tell patients when they come in panicked with a new diagnosis of MASLD that if we went to the shopping mall and put an ultrasound on 100 people, about 30 would have steatosis or fat in their liver. And the reality is, most people don't know they have it because it doesn't have any symptoms. It's often diagnosed kind of accidentally during an ultrasound or a CT scan done for other reasons. Now, having MASLD is not a reason to panic. Most of the time, it's completely reversible. Most of the time, it does not cause considerable damage to the liver. About 1 out of 5 cases, or 20%, will develop liver inflammation or damage to the liver. And so this damage to the liver is called steatohepatitis. So you'll hear the term hepatitis a lot. All it means is liver inflammation. So this steatohepatitis can lead to scarring and eventually cirrhosis, which we'll circle back to. But I always want to reinforce that a diagnosis of MASLD shouldn't cause panic. It doesn't mean you're going to go on to develop damage to the liver and cirrhosis. Most of the time, it's reversible, and we'll get to the treatments that can help to reverse it. Now, of those who have steatohepatitis or inflammation, approximately 20% of those will develop scarring of the liver and eventual cirrhosis. So, as I had mentioned, I'll circle back to cirrhosis a bit later. But one surprising thing is, even in patients with MASLD cirrhosis, the most common cause of death is not from liver disease, it's actually from heart disease. So, um, given that the risks of heart attacks and strokes are so high in patients with MASLD, the first bit of advice I have is to make sure they're seeing their primary care doctor and addressing blood pressure and diabetes and high cholesterol with things like diet and exercise and medications for blood pressure, cholesterol, and blood sugars. And this gets us to the treatment of MASLD. So, in addition to controlling blood pressure, cholesterol, and blood sugars, the most important treatment for MASLD is weight loss. And one of the cornerstones of weight loss is through improved diet and physical activity. So folks often ask me which diet, and we don't have a whole lot of comparative data saying which diet is the best. Probably the diet with the best evidence base for reducing risk of mortality is the Mediterranean diet. It has pretty good evidence. And so this is the one I recommend most often to folks, but there are many different types of diets that can be considered. There are also some new medicines for MASLD, including the first FDA-approved medication specifically for MASLD, which is called resmetirom. Some of the new GLP-1 medications may be helpful as well. So those are the ones that you've probably seen in the news, Ozempic, Wegovy. Oftentimes when folks have diabetes and MASLD, those can be helpful for the liver disease. Now, moving on to another really common liver disease, hepatitis C virus. So, hepatitis C virus is a virus that infects liver cells. It remains one of the leading causes of cirrhosis, of liver failure, and of liver cancer in the US. There are currently about 4 million Americans infected with hepatitis C. However, even though it can cause all these risk factors, the great news about hepatitis C is that it previously was an incredibly difficult to treat virus. We had these medications that were really, really tough on folks, took a really long time to treat the virus, and often didn't cure it. We now, within the last few years, have these new pills, direct acting antivirals, that cure over 95% of people in 8 to 12 weeks. So this is a true groundbreaking medicine. But even with these groundbreaking medicines, only about 60% of people who are infected with hepatitis C are aware of their diagnosis. Again, like MASLD, hepatitis C often doesn't have symptoms. So as a result of this, the CDC now recommends that all adults get tested for hepatitis C, regardless of whether they have symptoms or risk factors for infection. Moving on now to alcohol associated liver disease. So, alcohol damages the liver and can have a negative impact on many, many other systems, including the immune system, the brain, your mood, and many other organs. Liver disease with alcohol can occur with consumption of two or more standard drinks per day for women, or three or more standard drinks per day for men. So, folks often ask, well, what does that mean, standard drink? And this figure shows what a standard drink is. This is one standard drink is a 12-ounce beer with 5% alcohol. Now, of note, many of the craft beers and malt liquor have higher levels of alcohol, so a standard drink may be 8 to 9 ounces of each of these. A 5-ounce glass of wine is a standard drink, and a 1.5 ounce of liquor, a shot of liquor, is a standard drink. Now, oftentimes, individuals who also have MASLD or hepatitis C can develop liver damage at even lower amounts of alcohol consumption. So, for those folks, we tell them you should probably be much more cautious with alcohol use. Now, the most important treatment for alcohol associated liver disease is to stop drinking. But many folks with alcohol associated liver disease have alcohol use disorder. And this is a true disease that makes it really, really tough to get off alcohol. So, treatment for these folks can include things like inpatient alcohol rehab, group therapy, individual therapy, or family therapy. And this counseling is often most effective when combined with medications to reduce cravings and reduce the risk of relapse to alcohol. Ultimately, to prevent cirrhosis, liver failure, and liver cancer, it is essential that folks with alcohol associated liver disease stop all their alcohol, as there's no safe amount of alcohol. Now, whether it's from MASLD or fatty liver, viral infections, and alcohol, they can all cause damage to the liver. And I mentioned those three because they're some of the more common liver diseases, but there are other liver diseases um, in the US. So, hepatitis B virus. There are other genetic causes of liver disease. There are autoimmune causes of liver disease, where people's own immune system will damage their liver. So I didn't cover them all, but whatever it is that damages the liver, ultimately, it'll start to form scar tissue. And this scarring is called fibrosis. And over time, if this scarring increases and increases and increases, you can get a shrunken, hardened liver. And at that point, it's called cirrhosis of the liver, which is essentially just a lot of scarring of the liver. Now, a liver with cirrhosis has a hard time getting its regular work done. So, the regular factory work we had talked about. So, it may have trouble. The liver may not be able to produce its normal substances like proteins and blood clotting factors. It may have trouble storing what you need, like the sugar and vitamins we had talked about, and it may not remove all the toxins and bacteria that your body doesn't need. So, um, that can cause all sorts of complications. So one of the complications is issues with the immune system. So people with cirrhosis have a higher risk of getting infections, and when they get infections, they have a higher risk of developing complications like hospitalization or ICU stays. Because the liver is not making as much protein, your body starts to look for other places where it can get protein. So it breaks down muscle, and that can lead to muscle loss and weakness. And then, since the liver is not filtering out toxins, the toxin buildup can lead to confusion and forgetfulness in individuals. The other thing that can happen with cirrhosis is a plumbing issue. So normally you've got this big liver, and there's a big blood vessel going into the liver called the portal vein. And a healthy liver is kind of like a sponge for that blood. So it's very easy for the blood to get through the liver. But once it gets scarred up, like what happens in cirrhosis, that sponge essentially turns to a rock. So it's much harder to get blood through that portal vein in through the liver. And when it's harder to for the blood to flow through the liver, pressure can build up, and that pressure can lead to a number of complications. So that pressure can back up into the spleen, which is another organ on the other side of the body. And a larger spleen kind of acts like a sponge for platelets, which are a blood cell that help clot up bleeding. Uh, so stop bleeding. So individuals will develop a large spleen that'll lower their platelet count, and they'll be at higher risk of bleeding and bruising. This pressure can also lead to backflow of fluid into the belly. So folks can get a belly full of fluid, and this is called ascites. And this causes discomfort and can result in serious infection of the belly. And then lastly, this pressure will back up into other blood vessels, including enlarged blood vessels in the esophagus or food pipe. And these blood vessels can burst and bleed, and this can be life-threatening. And then the last thing that can occur is liver cancer. So I'd mentioned in the multidisciplinary liver cancer clinic, and we see folks who come in with liver cancer all the time. And most of the time, it's individuals who already have cirrhosis. So the biggest risk factor for liver cancer development is liver disease and cirrhosis. How do you prevent liver cancer? Well, the most important thing is to treat the liver disease. So the treatment of the MAFLD, the alcohol-associated liver disease, or curing of viral hepatitis C. Coffee actually also prevents liver cancer. So particularly for folks with risk factors, drinking a lot of coffee may prevent your risk of future liver cancer development. How is liver cancer diagnosed? What often shows up first on an ultrasound. So we say for people who have cirrhosis who are at high risk of developing liver cancer, it's important to get screened. And screening involves an ultrasound of the liver and blood tests for tumor markers. And this is recommended every 6 months for people with cirrhosis. How about treatment? So once we've found a liver cancer, we can do surgery to cut it out. We can do what are called liver-directed therapies to burn it or radiate it or block the tumor's blood supply to kind of choke off the cancer. There are systemic therapies like pills or infusions. These aren't chemotherapies, they're immunotherapies. And then finally, liver transplant can be considered. So, liver cancer is one of the few cancers that you can safely just take out the organ, replace it with another one, and have really good outcomes. So, with that, let me go over some of the myths of liver disease. So, one myth is that liver disease is always caused by alcohol. And I hope my talk today kind of showed how many different types of liver disease there are. Oftentimes, though, I get folks coming into clinic who've been diagnosed with liver disease, and they say, "Well, how can that be possible? I haven't had any alcohol in my life or haven't drank heavily." But there are many other causes of liver disease. There's MAFLD, there's viral hepatitis. As I mentioned, there are other diseases I didn't touch upon, like autoimmune liver disease. Um, And so alcohol is not the only cause. The other kind of related myth is that you have to be a binge drinker or labeled as an alcoholic to have liver disease. And this is not true. I mean, as mentioned before, it can be as little as 2 drinks per day, 2 or more drinks per day for a man, or more than 1 drink per day for a woman, can lead to liver disease. Another myth is that liver disease is contagious. So, yes, as I had mentioned, viruses can cause some types of liver disease. Many liver diseases, MASLD and alcohol, are not caused by viruses. But even the ones caused by viruses are not that easy to transmit. It's not like catching a cough or a cold. You can't get viral hepatitis by being near somebody with the virus. You can't get it by touching them or touching someone they've touched. Um, most the hepatitis B and hepatitis C are transmitted by the blood, or for hepatitis B, it's treated sexually. And so these are, not transmitted with day-to-day regular contact with folks. As I mentioned, MASLD and alcohol-associated liver disease cannot be transmitted from one person to another. A third myth is that you have to have symptoms to develop cirrhosis of the liver. And it's not true. It's possible to have cirrhosis of the liver and not know it. Many patients who have cirrhosis still have enough liver function to kind of maintain the body's normal functions. So, oftentimes the most common symptom is fatigue. And if you're like me, I develop fatigue all the time. So folks get fatigue for a number of other reasons that aren't liver disease. Some of the more well-known symptoms, so getting yellowing of the eyes or the skin, getting confusion, getting fluid buildup in the belly, some of the things that I had mentioned, those often come very, very late in the development of cirrhosis. So oftentimes folks have had cirrhosis for years before they even develop any of those symptoms. Another myth we often come across is that Tylenol must be completely avoided in folks with liver disease. And this is not true. So it's true that Tylenol is the most common cause of acute liver failure in the United States. But acute liver failure only happens if you take a lot of Tylenol. So usually over 4 grams of Tylenol in a short period of time. Liver failure almost never happens at doses less than 2,000 milligrams per day. So even for my folks with cirrhosis, I tell them, low dose Tylenol, less than 2,000 milligrams per day, may be one of the safest pain medicines out there. Just make sure to limit it to this dose. Myth number 5 is that even if I get cirrhosis, my liver can completely regenerate. Now, we used to say scarring is 100% irreversible. That's probably not true. But once you develop enough scarring of the liver that you have cirrhosis, it's impossible to go back to a completely normal liver. Um, the liver's regeneration kind of becomes very limited at that point. The liver is a very, very resilient organ. So you can cut out part of your liver and it'll regrow to normal size within a month or two. But that's not true once you have cirrhosis. So the liver ability to regenerate and regrow becomes very limited at that point. And then myth number 6 is that if you're diagnosed with cirrhosis, a liver transplant will be needed. And it's true that some people with cirrhosis end up needing a liver transplant if their liver disease gets much worse, um, or if they develop liver cancer, it may get to the point where a liver transplant's needed. Um, but it's worth noting that a liver transplant is not, a complete free lunch. So I tell folks that, this can be a life-saving surgery for a lot of folks, but it's still a major surgery and it has a high risk of complications. And it has downsides, including the need to take medicines to suppress the immune system for the rest of your life. So liver transplant is wonderful for folks who need it, but it's not recommended for everyone with cirrhosis. And just if you get a diagnosis of cirrhosis, it doesn't necessarily mean that you will need a liver transplant. So with that, I'll stop.